Hello, I'm Robert Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is modulation of wound healing and optimizing scar formation. Now, it's impossible to do surgery without scars. This can only be done in the makeup world of Hollywood. But there are numerous things that we can do and that affect your wound healing. Number one is genetics. Who you're born to and the genetics you have. Certain populations, those of color and those of Asian descent, have a higher incidence of hypertrophic or keloid scars. And we'll talk about the treatment of that. So, what are the phases of wound healing? They're basically three. There's the inflammation phase, that's in the first few days, where the blood vessels are starting to come together, the healing proteins, and everything is starting to come together. The wound is held together at this time by the fibrin glue, so it can be easily disrupted unless it's sutured shut. Then we have the proliferation phase, which everything is coming very quickly, but it's very, very disorganized. And then lastly, you have the remodeling phase or the maturation phase. And let me make a corollary. It's like building a house. When you first start to build the house, the tractors come, the bulldozers come, and you grade the lot. Then the workmen come with all the material. That's the inflammation phase. Now, more workmen come, the building starts to come up together. That's the proliferation phase. And now the building's built, and now you put the paint on it, you start the landscaping. That's the maturation phase. The time it takes to build a house is approximately 9 months. This is the time when the wound healing is usually finished at the maturation phase. It can be extended, but on the average it's that amount of time. So what do we do? Well, preoperatively it's very important. We want you to be in the good health. Optimize your health. No smoking, a healthy diet, and during this time, high proteins and vitamins within reasons. If you're a bariatric patient, we will measure your albumin, prealbumin, to make sure you have the necessary ingredients for wound healing. Now, just a bit about smoking. Why is smoking bad? Smoking goes ahead and think of it as a vice grip on your vessels. If this was the cut, it goes ahead and clamps down, not allowing oxygen, healing hormones, proteins, antibiotics to come on into the wound area. It decreases the oxygen saturation. That's the oxygen coming in. Because of this, the tissues can have a dependency on less oxygen, and then what happens is they can become necrotic and even die, thus setting it up for a wound infection even, and very bad scars. So I have optimally asked my patients to stop smoking 4 weeks ahead of time, but demand it 2 weeks ahead. And then optimally don't smoke 8 weeks after surgery, but optimally 4 weeks, or minimally 4 weeks after surgery. Okay, now let's move to the surgical technique. That's something we can affect. We as plastic surgeons are trained in precise incisions, gentle handling of the tissue, precise hemostasis, approximation with different levels of sutures, and the judicious use of electrocautery to stop bleeding. Our suturing technique is very, very important. We want the tissues to come together exactly even, not up, not down, not wide apart. This comes from experience and training. Okay, postoperative. There's things we can do to modulate the wound. I believe in a tension-free closure. What does that mean? Well, we bring the tissues together and we undermine or approximate it so we can approximate them without as much tension as possible. Why? If there's tension on the wound, they tend to spread over time. Scars are like stretch marks. Approximately only 60% as strong as normal tissue. This is why scars spread, even under the best conditions. So what else can we do? Well, at the time of surgery, I like to put Steri Strips that helps dissipate that topical tension that is exerted by the normal wounds. Number two, after surgery. If it's an abdominoplasty or breast reduction or arm surgery, which sometimes has the most difficult challenges in healing, I like to use a product called Embrace. What is Embrace? Embrace is a device very similar to like Steri Strips, but it actually brings tension on the wound together. This takes the tension off by wearing it for the first 6 to 8 weeks after surgery. It takes multiple applications, usually every 2 to 3 weeks. Some patients don't like the way it feels, but most of the patients tolerate it well, and I believe it really helps, and the science behind it does so also. After this 4 to 6 week period of Embrace, we go to silicone gel. Silicone gel tape is a tape we put on the wounds, and this is also scientifically shown to reduce the keloid formation. It acts like a barrier, it has the silicone gel, and then that helps modulate or have the collagen mature in a very good fashion. We also have the silicone liquid or chapstick that can be put on for the facial ones. Now we'll move to the 3 to 6 month period. What do we do during this? If we see a hypertrophic scar, and a hypertrophic scar is a heaped up scar that over time will come down to a normal level. A keloid scar will go straight up and then stay that big and continue, and even can extend beyond the wounds. A normal healing goes up and then comes down, usually at the 6 to 9 month period. So during this period, if we see this, we'll use our V-beam laser. How does that work? Well, hypertrophic or keloid scars have hyperemia, or too much blood flow. They're healing too well. So the laser comes in and then decreases the blood flow by coagulating the little small vessels without any incisions. Steroid injections. How do steroids work? Well, we're always building up and breaking down collagen. Some of you have heard of scurvy. This is when sailors would travel from England to the new United States of America. And because they didn't have vitamin C, their wounds would start breaking down. Their teeth would start, the gums around their teeth would start bleeding. Why? It's a cofactor in wound healing. That's why vitamin C is very important, as are the other vitamins. So, what do we do with the steroids? The steroids block the formation of scar in all phases. We do it where we put it through a small needle into the wound in a dilute fashion to slow down the wound healing phase. Then, what do we do with these recalcitrant scars, these keloid scars that you sometimes see behind the ears or earlobes? Well, or on abdominoplasties or around the umbilicus. With those, we work with our radiologist to use superficial radiation, where we will work as a team to revise the scar and then immediately send the patient for several treatments of superficial radiation to the wounds. Okay, let's summarize. Wound healing has 3 phases. One is inflammation, that's right after surgery. The strength is held together by the sutures. There's the proliferation phase, when all the ingredients and all the building blocks come to the wound. And third is the maturation phase, or the remodeling, where the wound starts smoothing on out. Scarring is based on your genetics, on surgical technique, on intraoperative handling of tissues. We want to optimize your wound healing by making sure your protein levels are good. If you're a post-bariatric or massive weight loss, that we measure them ahead of time. We want the abstinence of smoking. And then we want to modulate it after surgery with the techniques of Embrace, silicone gel, pressure, massage, and then, if need be, radiation therapy in the very rare cases. I hope you enjoyed this video and look forward to seeing you soon.